Hey guys, how's it going? It's Dr. Salemy. We're back in our office here in Seattle. We thought today we would talk a little bit about Botox and maybe touch a little bit on some other fillers. Had a huge response in terms of questions from folks, so that was really interesting for me. I will do my best to get through as many of them as I can. First of all, there was a lot of really nice just notes of encouragement and folks sending out notes saying stay healthy. Even one in Spanish from Denia Lavarich, I think it's how you pronounce it. Espero estés bien, saludos. I think that means I hope you're doing well. Cheers. I'm going back to my high school and college Spanish a little bit, but thank you very much. That was very, very nice.
It sounds positive.
Sounds positive. There was a wink. It's awesome.
Beautiful.
So cool. So let's talk a little bit about Botox. Let me just talk about it in general. What is it? How does it work? So Botox is a toxin. It's botulism toxin. It's a form of it. And it's designed to temporarily paralyze the muscles that it's injected into. Now, why does that work as a cosmetic treatment? Is because on our face, our muscles are connected right to the underside of the skin. So anytime, and that allows us to animate now. So that's why we can raise our eyebrows up and we can squint and all that. But over time, to a greater or lesser extent, that constant movement of the muscles causes lines to become more and more noticeable. For some folks, a whole lot. For others, not as much. And so Botox is designed to be injected into those muscles. And as it temporarily relaxes those muscles, it'll temporarily relax the lines. How much of a result you get depends on a number of factors. Certainly how deep the line is, how strong the muscle is, and then how many units of Botox are injected. You'll hear about that a lot in terms of how many units of Botox are you getting in a particular muscle. Different patients need different amounts, different injectors do different amounts. I don't think there's any one right answer. It really depends on the injector's expertise and the patient, and also sometimes some trial and error. Sometimes patients need to come back and maybe have a little bit more put in. The most common areas on the face that we inject are what's called the frown lines or the glabella, which is right here. These, you can look right on me, I got them. I've never had Botox on my face, so I got plenty of lines to show. You got these vertical lines here, the forehead lines that go across, and then the crow's feet when you smile. The procedure is really quick. It usually just takes a few minutes to do. We do it in the office. It takes a couple of days to start to see the effect. It doesn't happen right away. It usually takes about 2 to 3 days to start to see the effect. The maximum effect is about 2 weeks, and then it lasts somewhere around 3 months. Some folks a little bit longer, some folks a little bit less. I always joke with my patients that the good news is if you don't like the way it looks, it'll go away in 3 months. The bad news is if you really like the way it looks, you gotta come back often.
I flipped on me on accident.
Oh, it's okay.
That was a rough shot of me. Sorry, guys.
Oh.
Go ahead.
Okay. It's okay. I was like, what happened? So it'll go away in 3 or 4 months, and if you don't like it, it goes away. If you do like it, you're coming back pretty regularly to have it done. The risks of the procedure are awfully small. There's literally millions and millions of people worldwide who get Botox done with really great results. Things like bruising, swelling, unevenness, needing more done, overcorrection, so kind of a frozen appearance. That's pretty rare, frankly. One of the risks we always are thinking about is what's called eyelid ptosis, where the muscle that allows you, when you open your eye, the muscle lifts up to a certain point. Sometimes that muscle, the Botox can kind of work its way to that muscle, and it gives the appearance of kind of a lazy eye. There are some medications that can help with it while the Botox wears off. It's obviously concerning when you see it, but it's not any sort of lasting problem.
Someone had just asked about brow dropping.
Yeah, so 2 different things we're talking about. That's what I'm talking about is eyelid droop, so the eyelid dropping, but the brow can also drop as well, and that can happen if the Botox is injected too close to the muscles that help control the position of the eyebrow. So if you imagine all of our muscles in our face have a kind of a constant resting tension, and that creates the balance of our face. When you inject Botox into one muscle, you're relaxing that muscle. So whatever that muscle was doing, it will not do it as well. So if you inject it to this muscle here is the frontalis that raises the eyebrow up, and I think on me, I have a really deep crease kind of right above the eyebrow. I think it's on this side. So if I were going in for Botox and the injector injected it right over that, there's a risk the brow would drop. So sometimes we have to sacrifice that and say, look, we're not going to have your brow drop, but you may see a line here that you really want to get rid of. It's going to be a challenge to do that without risking dropping the brow. I drew a very crude picture here. I apologize if it's freaking out anybody because it looks a little odd, but I just wanted to demonstrate kind of the general areas. So most common areas right here, some people call them the 11s or the vertical glabellar lines. And we're typically injecting Botox somewhere about between, I typically inject for this area somewhere around 15 to 20 units to start. Men tend to have really thicker muscles there, so we may need to do a bit more. This injection goes right into the belly of the muscle, and that's where it really works. Across the forehead, everyone is different. Sometimes, usually starting around 10 units, maybe 15. And the pattern is different. So on a woman, we want the eyebrows to kind of arc laterally. We want this point to come up. We don't want it to be flat. On a man, you want the eyebrows to be pretty flat. So the injection pattern on a man versus a woman is a little bit different. On a woman, we're doing it kind of like a V pattern. So we're kind of coming out more like this, and then we'll inject the muscle through here. And this is just a generalization. Obviously, if there's big creases out here, we'll go for it. But we're really trying to avoid these areas. But on a man, you can make the pattern more flat and more of a rectangle because the brow can be even all the way across. So we're thinking about those things as we're injecting. And in these crow's feet, we inject usually around 5 units or so, give or take, sometimes more, sometimes up to even 10 if someone has really resistant muscles, right into the belly of the muscle. So not in the crease, but in between the creases. And this area we inject actually quite superficially, right underneath the dermis, and then we massage it into that muscle. And that works very well. And if you can get this right, you can even get this corner of the eyebrow just to pull up just a touch if you inject that the right way. Because this muscle, when you squint, it pulls that corner down. So when we relax it, it'll allow this muscle to pull up. That's kind of a general idea. We also do sometimes the bunny lines, 1 or 2 units on either side there. That works really well. I hope that makes sense. Icing afterwards is really important. We have folks ice for maybe just an hour or 2 afterwards, and then taking it easy the first 24 hours, not working out right away. But then after that, get back to doing whatever you want to do. Hope that is a good starting point. Let me go through some of the questions, and then we'll answer if there's anything that's popping up, I can answer that first.
The only question we have on here, is it okay to have the filler in the temples?
That's a great question. I think the answer is yes, it is okay to have it in the temples. It's something, just like everything we're talking about, you want to go to people who do that particular procedure routinely. So, for example, if someone came to me and said, I wanted fillers placed in my temple, I honestly don't do that regularly, and I would tell them I'm not the right person for that. But there are a lot of injectors that do, and it doesn't have to be a doctor. I mean, as a doctor, I'll tell you, some of the best injectors I know are not doctors, they're nurse injectors, and they are fantastic at it. We're always happy to talk to folks about who we like for specific things. But if you really want to have that done, I would urge you to find someone and talk to someone that does it routinely. They're going to get a really good result in that way. So let's talk about Botox. I'm going to go through a few of the questions. Let's see. Let me go through it. Oh, this is a good question. Do we inject Botox in the armpits? Yes, that's actually a really great place to inject Botox. It's designed to help with sweating. I honestly believe that is a game changer. Botox in the armpits truly can change someone's life because it takes 10 minutes to do, and then if done properly, you will not sweat in your armpits for up to 6 months. So for folks, especially in the summer, you're wearing something like a gray t-shirt, and you can see these sweat patches. It's really embarrassing for all of us if that happens. So Botox there works really well. It takes, in my experience, you're going to need about 50 units of Botox per side. And depending on what the injector charges, that can be most injectors charge somewhere around $15 a unit, maybe some places a little bit less, some places a little bit more, but that's kind of an average. So you're looking at a fair amount of investment. But if you think about it, you're able to, if you do that twice a year and you don't have to sweat at all, it's pretty great. So I highly recommend it for folks who have a lot of sweating in their armpit. We talked about restrictions for aftercare. Let me see. There's a question from Botox. I haven't personally seen that. Botox tends to be incredibly well tolerated. You also mentioned about fillers. There are some folks who if they have a history of herpes outbreaks around their mouth, those really bad cold sores, and then you do a filler injection around the lips. Some folks can get a little sore that pops up. So in some patients, we'll put them on an antiviral medication just temporarily for a day or two, just to help with that. Some folks can get that, but from Botox, really haven't seen it. Folks tend to do really well with it. We talked about how long. It's also a question from Kelly Jean. She talked about how long the Botox lasts. We talked about that. Fillers, they last a variable amount depending on the type of filler. Some fillers will last 6 months. Some fillers will last a year and a half. It depends on the type of filler. Just talk to your injector about it. It's important to know that as fillers are being dissolved, it's rare for that area to go back down to what it was before the injection completely. There's usually some residual fullness, only because as the body's dissolving the filler, it usually lays down some collagen in its place. So it doesn't go all the way down. The only way to really get it all the way down to what it was before would be to also inject an enzyme called a hyaluronidase, if it's a hyaluronic acid filler, to basically inject a dissolving agent to dissolve the filler as well.
We do have a question. Can Botox be used to fix the nose if there's a bump?
I have never heard of Botox being used for that. I think what you may be thinking about is a filler being used to help with that. So the most, and it's important to understand there are different things. Botox is a medication that relaxes muscle. Fillers add volume. So there are differences. So let's see, if we're looking at a nose kind of from the side, it's kind of going straight down, okay? And this is kind of called the radix of the nose. The eyes are up here. So it's going straight down. Some folks will have like a little bump like that, like a dorsal bump, and they want this area filled to kind of make it smooth. And there's some really skilled folks that will do that with different types of fillers to try to soften that. They look great. I think that in the right hands, it can work really well. There are some risks with injecting fillers into the nose because it's a really vascular area with big vessels, and if you accidentally get the filler into the vessel, you can get into some trouble with skin problems. I'm also not sure of how long that result will last. I think it's probably, you shouldn't expect for it to last the same as a regular rhinoplasty would. And I think the expectation is to be very careful with those expectations. The place I think it works well is, let's say you had a rhinoplasty and you have just this small little contour irregularity. That would be a place to consider doing it instead of going through a whole full operation again to correct it. That's something to talk to your surgeon about. But it can be done. Again, find someone who does it all the time. Let's see. I have a question also about filler. Well, let's start with we talked about this from Krista Treat. We talked about Botox costs somewhere around $15 per unit. So depending on how many areas and how many units you're getting, just talk to your injector about that. So for example, for us, we'd be putting about 20 units in here, maybe 5 per each side here, that's 30, and then maybe another 10 or so across the forehead. So that'd be 40 units. We typically charge around $15 a unit, so what is that, $600, something like that. But again, everyone is different. In terms of the fillers, a good question also from Krista Treat asking that she wants to get lips done but doesn't want anyone to know. Is one time enough? Great question. So when we inject filler into the lips, no matter how little we inject, it swells. I think that it's important to know that. So you don't want to have it done, let's say on a Monday, and then have an event that night, unless you want them to look full. If you don't want anyone to know, you would probably want to do it where you have a couple of days off, or at least a day off, and you may get a little spot of bruising. Some folks get a little bit of bruising. Most people don't, but some folks get a little bit of spot. So I typically tell folks it depends on what they are looking to achieve. If they want to keep it subtle, we definitely want to start with only maybe 1 syringe of filler, which is about 1 cc, divided between the upper and lower lip. And then to do it when they have a little bit of time to just make sure the bruising and swelling goes down, maybe a day or so. And then sometimes that's all you need. It depends on how full you want the lips. Some folks will come back after a couple of months and say, okay, I've lived with this for 1 month or 2 months, and I do want a little bit more, and then we can put in a second syringe.
I have a question.
Yeah.
Do you do Botox for migraines?
I don't do Botox for migraines. It's typically, in my experience, I've seen that done by neurologists, and it can be covered by your insurance, which is great. So if you do have migraines, Botox can really help with that in the right situation, I would definitely talk to your neurologist about it. And it gets covered by insurance. Interestingly enough, I've had many patients who are coming in for cosmetic Botox who then tell me afterwards that their headaches have softened. I don't have an explanation for that as to why, if we inject Botox into these superficial muscles, that their headaches get better, but we've had folks tell us that. Okay, this is actually a great question for from All Things with Love. That's a nice thing. For under eyes filler and bruising. So a lot of folks have these deep tear troughs kind of right through here, and the deeper they are, the darker they look. They look kind of like almost like there's a shadow falling there. And filler can be a great option in that area. Of all the areas that we inject filler, I think this area is probably the most technically challenging and the least forgiving. And the reason for that is, even though there's a muscle there, you're actually, if you get into that muscle with the filler, you can end up having a bit of a problem with swelling or even a bluish discoloration, and you can't put too much in there. It's such a delicate area that in my practice, I won't inject it into that area just because I don't do it regularly. Done again in the right hands, the right person doing it who does it all the time, I think you can get a good result, but it's risky. They're always going to tell you, look, there's a chance of swelling, persistent swelling. I mean, like for months and months and months, and even a blue discoloration. So you have to talk to your injector about that and be willing to accept that as a possible risk. That being said, if it's done well and you heal well from it, it looks great.
I have another question.
Yeah.
Do you have to use the whole syringe if you want a more natural look for your lips?
No, you don't have to. Sometimes what folks will do is they'll use part of the syringe and then maybe give it a few days and then come back and use the rest of it. We don't like to leave the syringes unused for too long because you kind of run the risk of now you have a syringe, even though it's used on the same patient, could you get into an infection? Could the syringe, the product expire? I try to tell folks, look, you can purchase the syringe and we could use just part of it and we could save some of it, or we can maybe throw it away and then see how you go. But I will tell you that it's pretty rare, frankly, for a patient to be satisfied with less than one syringe when they've never had filler put in. They typically are going to need that one syringe just to see some degree of difference. Okay, and then a couple of questions. I had a good question about fillers. There was a few questions about fillers I hadn't gotten to. Let me just answer that. Fillers for the hand. This is from Cat Bar. Really, really popular area. As folks age, they start to lose the volume in the dorsum of their hands and the veins become more noticeable. We see that most of the time women are coming in for that because it really gives away their age. There's a lot of good options for this area. Some folks use the patient's own fat, and just like a fat transfer to another part of the body, they'll fill that area. That works really well. I've used a product called Radiesse, Radiesse, and that's something we can use with the patient awake, just here in the office. We mix the Radiesse up with a little bit of numbing medicine, a little bit of lidocaine, and then we can inject it into that area and massage it in. Huge difference. I mean, it looks fantastic when you get that. I think it's one of those procedures that's a lot of bang for the buck, and it works really well. There's other ways of doing it, but for me, Radiesse has worked great for the dorsum of the hand. Thanks for all the well wishes. Actually, people have been sending us lots of hope everything's well. Hope you guys are staying safe. We had another question from Sharzad talking about how long fillers last. I think we answered that. And for fillers in the lower eyelid, again, be careful. There's another question from Cat Bar about Botox in the jawline. Yeah, you can have Botox injected into the masseter. That's the big muscle that when you bite down, it's pulling your mandible up. That helps soften the jawline. Again, wanting it done by someone who does it all the time, I think would work great. Let me see if I have any other questions that we can answer.
We've got some over here.
Yeah, go for it.
Fillers, can you clarify injection used on the buttocks?
So, that's an interesting question. I have never I've never injected anything other than a patient's own fat into their buttock. I know there's some people out there doing it. I'm wondering if a lot of that is what's called off-label use. So you can do things off-label, which means it's not FDA approved for that particular procedure. I have no real experience with that, to be honest. I always get a little bit concerned about that. See, the face, it's so vascular the blood supply is so rich that we're typically not as concerned about an infection as we would be injecting a product into another part of the body. But injecting into the buttock, I would really urge you to find someone, if it's not going to be your own fat and it's not going to be a gluteal implant, I would really encourage you to find somebody who does it routinely and who has a lot of success with it and is using a product that is designed for that indication. Yeah.
Another one was fillers injected for the chin, which I think you talked about Botox for the...
Yeah, so I've never done a filler for the chin, but you can inject Botox into this area to soften some of the kind of the crepiness with smiling. I've seen that done pretty well. Chins typically, I've seen chin implants placed. There's other types of implants that can be placed in there to give it better fullness and correction. But a filler probably is not a bad idea. I bet you there's people who do that, do it well. I tend, in terms of fillers in my practice and Botox in my practice, we try to really do things that we've done a lot, that have lots of proven results, such as the Botox in these areas, fillers for the lips, fillers for the nasolabial folds, which are these kind of creases that go from the nose down here. Those areas do great. We also will do some fillers for the cheek that can give a really nice shape as well for women who've lost some of that volume there.
Another question is filler for the temple. Is that good for a sagging lower face?
No, I don't think it would be designed. If you're wanting to address the lower face, we need to look at options for addressing the lower face, not injecting something away from that. Lower face options are, it comes to everything from fillers, Botox, all the way to surgery. One of the key elements or key points maybe to take home is, if you need an operation, you should consider that and not something short of that. So in other words, you may go to a surgeon and say, I want, or a provider of some kind, and say, I don't like the way I look tired. And realistically, an operation like a facelift or a neck lift or a brow lift or eyelid surgery is what you need. If you do something short of that, you're probably not going to get the degree of result that you're wanting. So it's important to have that discussion and maybe try something non-surgical first and kind of see how you go. But you really shouldn't expect a surgical result from a non-surgical treatment. They both kind of have their pros and cons. So it's important to really talk to someone who can talk to you through everything from skincare, injectables, fillers, surgery, and kind of give you the best plan.
That's all the questions.
Cool. Well, the final thing I wanted to announce today is we have actually two things. One is we have the winner of our Botox giveaway.
Woo!
Yeah, and the winner is Krista Treat. She has won a free Botox treatment. Congratulations, Krista. That's great. Look forward to seeing your office. We'll be contacting you really soon with that. And then the other final thing I wanted to say is, you guys maybe when you follow us on Instagram, you may have noticed some posts about a scholarship that we're giving away. I think this is maybe our 4th year giving a scholarship away. We set it up a few years ago to do a scholarship to a high school senior who wants to go into the sciences. It can be any kind of science. It can be any type of college, community or 4-year college. And basically they just apply, they send us a letter saying why they think they would do well with it. And then we usually get a lot of applications, and then we'll pick 1 or 2. I think in the last couple of years we picked 2 folks because there was just so many deserving people. And then once they get into school, we send a check over to their school for some money, and it's on us. And we really want to encourage folks to go into science and be the next generation of great doctors, nurses, science leaders. It's been really fun for us. So the application deadline for that, I think we extended it, given everything going on with the coronavirus. I think we extended it into the summer. So just check out our feed for that, and please apply. We'd love to give away some money. So thank you, everybody. You guys have been great. I hope we answered all of your questions. Keep them coming. We're always happy to answer them offline as well. And take care of yourself. We'll see you soon.